The second disease that we'll be talking about is acromegaly, and it is characterized by hypersecretion of growth hormone caused by the existence of a secreting pituitary tumor in 95% of the cases, and usually these tumors are benign adenomas. It is rarely caused by extrapituitary disorders, usually caused only by pituitary disorders. And hypersecretion of the growth hormone causes hepatic stimulation of insulin like growth factor 1. And the symptoms include body odor, easy fatigue, enlarged jaw and tongue, carpal tunnel syndrome, enlarged feet and hands, excessive height, decrease in muscle strength, enlarged glands in the cell, as well as excessive sweating. So, this is the second condition where you have hypersecretion of growth hormone caused due to hepatic stimulation of insulin like growth factor 1. So here the symptoms would be headache, hoarseness, joint pain, limited joint movement, sleep apnea, weight gain, swelling of bony areas around the joint, thickening of skin, presence of skin tags, widely spaced teeth, and even excess hair growth in females. So the striking features of acromegaly includes supraorbital ridges, like you have a very prominent forehead, and broadening of the nose. In this figure, you can see a broad nose, thickening of the lips, thickening and wrinkle formation on the forehead, and lower jaw prognathosum. That is, your lower jaw remains protruding outer compared to the upper jaw. So investigations that can be taken up, like visual field test, assessment of other pituitary hormones like prolactin, adrenal glands, adrenal hormones, thyroid hormones, or gonadal hormones, MRI scan of pituitary and hypothalamus, CT scan for lung, pancreatic, adrenal, or ovarian tumors that may secrete ectopic growth hormone or growth hormone releasing hormone, and total body scintigraphy, cardiac assessment through electrocardiogram or echocardiogram. So prognosis is pituitary surgery, which is mostly successful. And if it goes untreated, it can cause arthritis, cardiovascular disease, colonic polyps, glucose intolerance, glucose intolerance, diabetes, spinal cord compression, uterine fibroids, vision abnormalities, and sleep apnea. The third disease that we'll be talking about today is dwarfism. So, in dwarfism, there is a growth hormone deficiency and a hypersecretion of growth hormone. The person remains of short stature, and there is disappropriate body parts. Pituitary dwarfism is seen in 1 in every 3,800 births. That is, the occurrence is very high. So, achondroplasia is the most common form of dwarfism, where you have an average size body trunk with short arms and legs, and you have a slightly enlarged head with a prominent forehead. So, you're born to average size parents, and average adult height becomes 4 feet tall. Diagnosis is usually in the childhood based on visible symptoms like physical examination, genetic testing, and even diagnostic imaging. Prevention, it cannot be prevented. It's a genetic disease, cannot be prevented. So only thing is that you can go for genetic testing and you can have injections of human growth hormone during early life. So the next disease that we'll be talking about is the syndrome of inappropriate hypersecretion of antidiuretic hormone, which is a disease characterized by loss of sodium through urine due to hypersecretion of ADH. So increased secretion of ADH is caused due in CNS or central nervous system stroke, hemorrhage, infection, trauma, psychosis. Use of drugs like cyclophosphamide, vincristine, vinblastin, amiodarone, ciprofloxacin, theophylline, and other antipsychotic drugs. Pulmonary conditions like pneumonia, asthma, post-operative states like major abdominal or thoracic surgeries. So the ectopic secretion of ADH in as seen in lung cancers, tumor of duodenum and pancreas, etc. Increased sensitivity to ADH on prolonged use of NSAIDs. NSAIDs are known as non-steroidal anti-inflammatory drugs and cyclophosphamide, etc. And there could be miscellaneous reasons like AIDS or malnutrition. Signs and symptoms include loss of appetite, weight loss, nausea and vomiting, headache, muscle weakness, spasms and cramps, fatigue, restlessness, and irritability. In severe conditions, patient could die because of coma and convulsions. So the disease has a neurological pathophysiology towards it, like hyponatremia is where your blood concentration of sodium is low. Hypoosmolality, that is your osmotic pressure, remains low, and both of this can cause acute cerebral edema, that is water content in your brain increases, causing edema, and the brain extracellular fluid moves into the cerebrospinal fluid. There is a rapid adaptation that occurs within hours as a result of loss of electrolytes, and a slow adaptation occurs over several days with the loss of organic osmolytes. So, in improper therapy, it could cause osmotic demyelination, whereas in proper therapy, it could cause a normal brain, that is due to a slow correction of the state. So, treatment includes antidepressants, anti anxiety agents, antipsychotic agents, and desmopics.